Hello, everybody. My name is Maria Balinska. I'm the Executive Director of the US-UK Fulbright Commission, and I want to welcome you to our first ever virtual alumni event. This is exciting for us on lots of different levels, and the most basic one is that hosting this discussion on Zoom allows us literally to go global. Our fantastic speakers are in front of their computers on both sides of the Atlantic, as are you, I know, and I'm so pleased to share that our audience includes alumni from the 1960s on up to the 21st century. Global is a key word whenever talking about COVID-19. This virus is causing a global disaster, and to solve it, we really need global solutions, which is why the Fulbright mission of advancing knowledge, building bridges between countries, and developing compassionate leaders is so incredibly important right now. There are many Fulbrighters making a difference in these difficult and distressing times, and they're doing so in a myriad of ways. So in today's event, we deliberately wanted to have a wide-ranging discussion that includes Fulbrighters that are on the medical front lines of the fight against COVID-19, as well as educators who are thinking about the social impact of moving schools online, and urban planners who are looking at the future of cities in a world dealing with pandemics. The next hour is about sharing learning and life experiences from our speakers and from all of you taking part, because it's also about the Fulbright community connecting and sparking thoughts and ideas. So just a few words before we go to our speakers. The format is going to be that they will answer a couple of questions from me, and then we'll open up to your questions. At the bottom of your screen, you can see the Q&A box, which is where you can type your questions. And if they are for a particular speaker, please put their name in there and start typing them in whenever you want to. We'll be taking note of them in the back room. And just to let you know also that if you need to leave early, we're going to be recording this event, and so it will be available to you later on. So to begin with, to find out who our wonderful panelists are, we've asked each of our Fulbrighters to tell us a little bit about themselves and to share with us one way in which their Fulbright experience has had an impact on their work. So we're going to start by going to Scotland and introducing Louisa Harding-Edgar, who's both a practicing general practitioner and an academic at the University of Glasgow. And I'm very happy to say also the new chair of the US-UK Fulbright Alumni Council. So Louisa.
Hi, Maria. Thank you very much for having me to do this webinar. It's really exciting and a lovely opportunity to talk about what I've been up to. As you said, I'm a GP in Glasgow, and I spent my Fulbright year in 2016 to 17 at the Harvard T.H. School of Public Health, doing a master's in public health. I now work 2 days a week in general practice, and usually I'm a GP academic fellow for the other days of the week at Glasgow University in the Centre for Primary Care and General Practice. But my research contract has actually been paused so that I can return to full-time clinical work in the NHS. And this for me has meant continuing to be a GP 2 days a week and spending the other days working for NHS 24, which is our NHS 111 service, doing COVID triage. So this means that when a member of the public phones up, we assess them over the phone, decide whether they are safe to manage at home, whether they need a GP to come and visit them in the community, whether they should attend an assessment centre, or whether they should go to hospital or have an ambulance to take them to hospital. And this has been really fascinating work and quite complex and quite uncomfortable sometimes, because as GPs, we're not really used to making all our decisions over the phone. So this has been a really big learning curve, and also a learning curve like it is for all clinicians, because we're dealing with a virus that we don't necessarily fully understand yet. It's been complicated, but absolutely fascinating. And then the other 2 days I'm back in my practice, where I'm kind of seeing the other side of the health system, the non-COVID side, where we're still dealing with the everyday things that we see in general practice, from serious illnesses to the more minor things, and again, trying to deal as much as we can with things over the telephone. I've managed to keep a bit of academic work going, largely working with colleagues on looking at care homes and what's going on with care homes during the pandemic, and how under-resourcing of care homes has maybe led to a bigger crisis, a devastating crisis that we're seeing now for residents of care homes during the pandemic. And Fulbright, for me, was an amazing gateway to get back into academia. I'd been a clinician for a number of years when I decided that it would be useful for me to learn more about public health and to take a sidestep into academia. And Fulbright was quite unusual in that it does allow people who have started careers that aren't necessarily academic to get into academia, and that's really informed my current work. And I think there's been no more important time than right now for clinicians to have a good understanding of public health. So it's been hugely beneficial in that way.
Thank you so much, Louisa. And that bridge between academia and the wider public is indeed something I think that Fulbright has a really wonderful role in. And we're going to stay in the medical realm and go to Oxford with Laiba Husain, who is a researcher at the university's Nuffield Department of Primary Care Health Sciences. Laiba, over to you.
Hi everyone, my name is Laiba Husain. I was a Fulbright Scholar at the University of Birmingham in 2017-2018, where I did my master's in public health. I really wish I had paid more attention during my infectious diseases lectures. That information would have been really helpful right about now. Next slide, please. I did pay attention most of the time though. So just to give you a little bit of background on myself, I am originally from Michigan, where I did my undergrad at the University of Michigan before doing my Fulbright year at the University of Birmingham, where I did my master's in public health. Last year I started an early career research fellowship at the University of Oxford in the Primary Care Health Sciences Department, which is where I'm at now. Since I started my fellowship, I've been working on a UK-EU initiative called Paradigm, which is, bear with me, stands for Patients Active in Research and Dialogues for an Improved Generation of Medicine. So this project basically centers around embedding system-wide change in patient public involvement in research. I've really been able to leverage my Fulbright, the impact of my Fulbright year on my work in this project, because my research was specifically on patient-centered medicine and evaluating the healthcare needs of vulnerable populations like refugees. So I've been able to take these learnings and apply them directly to answer the question of how do we actively engage vulnerable patients with rare diseases like lupus or hemophilia in the life cycle of medicine's development. And so while I'm still very much working on this project, just last month, our department launched the Principal Trial, which a lot of you may have heard of. It's one of the 3 national priority clinical trials in COVID-19, which I've had the opportunity to be a part of. Slide, please. So just to give you a little run through of the Principal Trial, what this trial is aiming to do is to rapidly evaluate the different treatments that could stem the progression of COVID-19 symptoms, specifically in older people, and to help ease the burden on hospitals. So the trial is recruiting participants through GP practices across the whole of the UK. And what's really unique about this trial is that the platform is very flexible. So by setting up a nationwide primary care research network across the NHS, we're able to rapidly evaluate potential new treatments for COVID-19, and the trial will allow us to make treatments that are proven to be effective as widely and as rapidly as possible. Next slide, please. So in light of the COVID-19 situation, as we know, a lot of GPs across the UK have started doing virtual medical consultations online. And while these have been ongoing for some time now, even before the pandemic, I think the question of its efficacy is now even more important. So I'm really excited to say that I'll be starting my PhD on evaluating the effectiveness behind diagnosing medical conditions through online interfaces next year. Thank you.
Thanks very much, Laiba. And Laiba, as you saw from that map, is a Michigan native, as is our next speaker, who's currently in New York, Reed Swear, and who is the Senior Equity Associate at New York University's Metropolitan Center for Research on Equity and the Transformation of Schools. So Reed's turn to tell us a little bit about himself and the impact of his Fulbright year.
Good afternoon, everybody. It's really a privilege and a pleasure to be connected across the ocean here. So a lot of my work stems from my Fulbright and Distinguished Award in Teaching that I received in 2017, 2018. And I was studying at the University of Edinburgh under the mentorship of Louisa Harding-Edgar. And moving into that, my field of expertise is K through 12 education, primary school teacher and administrator in California and New York State. And a lot of the work that I do and have kind of done since Fulbright has been around the space around equity. So how do we build systems and schools and classrooms that push equity and push what does it mean for each student to fully feel a part of a classroom environment. In this work, stemming from my Fulbright inquiry project, it's much of it is the examination of self. So how do our own identities, our own privileges, our own power that we bring into a classroom and a school impact those around us? Particularly, what are the disproportionate impacts on students of color in the systems that we have contextually in American schooling and UK schooling as well? In doing so working for NYU Metro Center, has been doing equity work for the past 40 years in New York State. And in the last few years, we've been really engaged in this idea around disproportionality. And we've had a contract with New York State for the last 15 years doing that work. Currently, I'm part of a 4-person team called the Innovations in Equity and Systemic Change. And our big push is around how do we train culturally responsive and sustaining education. And as you'll see in this next slide, New York State's been at the forefront for pushing the idea of building spaces that look equitable, that feel equitable around 4 different parameters. So this idea of building welcoming and affirming environments, high expectations and rigorous instruction, ongoing professional learning and support, and then inclusive curriculum and assessment. So a lot of our entry point here is understanding where disproportionality lies in outcomes for students, recognizing that disproportionately students of color are impacted, students with a special education assignment are impacted, and these numbers that show these disparate outcomes have been around for decades. And right now our move is to recognize what's happening with the response to crisis. So when structures are already embedded, structures of white supremacy, structures of marginalization, when those are already embedded in the school system, what happens when crisis hits? And what we've seen is these levels of disproportionality and outcomes, achievement-based outcomes, only rise. So a lot of our work now is thinking about what does remote education look like, and we'll get into that a bit. But I'm excited to be here and really feel grateful to have this opportunity to engage with you all.
Reed, thanks so much. And our 4th speaker is Stephanie Pincetl, who is the founding director of UCLA's California Center for Sustainable Communities, and whose 2020 Fulbright was interrupted by the coronavirus and therefore is still in the UK in a village to the east of Manchester in the High Peaks. So over to you, Stephanie.
Thank you. And it is, as people have said, quite an honor and a privilege to address you all, wherever you may be. I approach this, my problem in the ways in which the COVID virus has been affecting all of us from a slightly different perspective. I have come to Manchester because I'm really interested in a post-carbon city. What do cities look like when we remove fossil fuel energy? And we begin to realize the depth at which the use of fossil fuels permeates all aspects of the way we live every day. So the COVID-19 epidemic has been very, very interesting because at the one hand, we've relied ever more on the global networks to supply us, the Amazons of the world, bringing us everything from the world. And yet, on the other hand, the reduction in travel, the reduction in air travel, and so on, shows what it might be like to move to a much less carbon-intensive world. Next slide, please. So being in Manchester has been very provocative for me. It's absolutely the right place because Manchester was the heart of the Industrial Revolution, this region where we are now, where I am now. And the realization that the Industrial Revolution was predicated on the use of coal, of hydrocarbons, and that what this new manufacturing approach was able to bring about is increased urbanization. We are now in a time where people say in a very facile way that we live in an urban world, that more people than ever before in human history live in the world. Yeah, I mean in cities, pardon me. And so that is a result really of the Industrial Revolution and of the ability to harness carbon fuels. But because carbon fuels are so immensely toxic to the planet and and create greenhouse gas emissions and climate change, we really do have to consider in a very serious way, how do we live without carbon? What is a post-carbon city? And so being out here in the countryside has been very helpful to my thinking about this, looking at agricultural practices and thinking about where my food comes from, and really writing about a vision of post-carbon cities that involve smaller cities, cities that are better integrated with their surrounding regions, cities that rely more on local craft and industry. My husband recently bought scissors from Sheffield, where there's still a few scissor makers, but it used to be a very big center for that kind of craft. And probably a lot less trade globally and much more self-reliance. We will be connected as we are now through IT. I think that renewable energy resources will be sufficient to do that, although this form of communication is very energy intensive. And that there will have to be significant recycling and repurposing and reduction of primary inputs. We will not throw as much away in big waste dumps. Believe me, we will be combing through all of those resources and reusing them. Next slide, please. But it does raise a whole set of issues about provincialism, xenophobia, anti-intellectualism. Will this post-carbon future deepen regional, national, and international inequalities? If you live in a northern country where it's very, very cold, then you have very thin soils. How well are you going to be able to provision yourself with food? If you live in an extraordinarily hot climate or desert climate, what happens then to things like food production or resources, availability of resources? Some have posed this as local cosmopolitanism, which is a very nice term because we will continue to be connected. And so these are the kinds of questions, I think, in some of the questions, but some of the really important questions that come about when you start to think about a different urban future. Last slide, please. And so in sum, a post-carbon future challenges us to rethink the role of cities. There's been a lot written in urban theory about cities. I mean, so much written, many words, but most of them talk about cities as facts, and cities as things. They don't pose the question about what we want cities to become in the future. And what I intend to write about and hope to get to is that cities could become places more in a more deliberate way, places of learning and culture, places of cultivation of the virtues of tolerance, of civic mindedness, and of sharing, if we're going to be continuing to live on the planet together, these are virtues that cultivate. And we know that virtues can be cultivated. We simply have spaces. Simply is a facile way to put it, but we do need to create spaces and intentionality in that direction, and that cities can remain and continue to be places of invention and innovation that can diffuse through this kind of IT network across the world, but are really from localities and addressed to the issues of living in place without so much global globalization. So that's what I've been thinking about out here in the countryside dominated by sheep. More sheep than people, I think. And I want to thank the Fulbright Commission for having the opportunity to really be in place to think about these things. Thank you.
Thank you, Stephanie. And thank you also for energizing us with that vision of an urban future. We're going to come back to you, of course, but I wanted to start with some specific sort of more medical questions for Laiba and Louisa. And to start with Laiba, because as you said in your introduction, Laiba, you're working on one of the 3 national priority trials in the UK to evaluate potential treatments for COVID-19 and specifically on older people. And I wondered if you could tell us a bit more about how the study is actually being conducted and when you expect to have your first results.
Yeah, so how the study is actually being conducted is that it's a two-armed randomized control trial. So parts are randomly allocated to either undergo standard care or a hydroxychloroquine drug treatment plus standard care. So the study drug in the first instance that is being used is hydroxychloroquine sulfate, and the hypothesis is that it'll be superior to standard care at reducing the need for hospital admission or death for this population group. So while the 2 main outcome measures that this study is looking at is hospital admission and death, there are a lot of secondary outcome measures that that we are trying to look at, such as the duration of severe symptoms, the time that's taken to full recovery of illness, consumption of antibiotics, oxygen administration. So a lot of these things are measured using daily online symptom scores and diaries, which is something that the participants will be filling out online, and other things like, ICU unit admission, admission in the hospitals by looking at records and GP notes for the duration of severe symptoms. But the study is specifically looking at the subset of populations that of the older population, and how they're doing this is through a very strict set of inclusion criteria. And this is specifically for patients with symptoms of COVID, like continuous cough or high temperature within the last 7 days, but in people who are age 65 and over, or they are aged 15 over but have specific illnesses like a weakened immune system or a known heart disease, asthma, lung disease. So again, this is targeting those who are most vulnerable. And as for results, we're currently in the recruitment phase, and this is still ongoing currently. So the study is actually expected to run until March 2021 and has just now started recruiting patients, and it aims to recruit over 3,000 patients. And that number may also increase if additional treatments are added. So it's safe to say, I think that it'll be a couple months before we can look to see any results.
Thanks so much. And just how many, are you going to be looking at every single treatment that comes your way?
Well, are you asking about me specifically?
No, the study. The study.
Yes. So it's a master protocol is what it's called. So while hydroxychloroquine is the first drug that's being tested, as new medications come along, the study is framed in a way that it can evaluate a lot of different drugs simultaneously, and that's why there's such a large number of patients being recruited across so many different GP practices. So I guess the study will be trying to look at a lot of different drugs throughout the next couple of months.
Thanks so much, Laiba. My next question was to Louisa, and actually Simon Hughes has pretty much the exact same question written very eloquently. So I'm going to read his question to Louisa, which is, what are the learnings from the current crisis around continuing to provide care for those with other chronic conditions, non-COVID, for example, cancers, to ensure we don't see unnecessary suffering and early mortality? I'm hearing that GP surgeries, at least in the east of England, are much quieter than normal. Do we face a hidden healthcare crisis in the making? Louisa, that's the one I was thinking also, what are the long-term medical costs of social isolation?
Yes, now my internet connection, it says, is unstable. I hope that you can still hear me. This is going to be a big problem, and I think it's something we need to act on very quickly to minimize the effects. The drop in consultations is huge. Just anecdotally, in the practice that I work in, we normally would see between 40 and 60 patients a day face-to-face in the practice. And when the lockdown started, the first day we received about 12 phone calls from patients looking for advice or assessment, which made us really nervous, because we just started to wonder what we were missing, what people were sitting at home with and not coming in with. This has increased slightly now, but we're nowhere near getting the questions or the requests for assessment that we would get in the past, just in the last 8 weeks. This has been reflected as well, not just in general practice, but in A&E attendances. So in Scotland, we've seen a 55% reduction in attendances at A&E. And it's hard to say at the moment how much of that might be due to changes in behaviour. We know there are fewer cars on the road, people are staying inside, so there may not be things happening in the way that used to happen that required medical attention. But that can't really fully explain why we aren't seeing so many chest pains, strokes, and cancer symptoms. I have some stats around cancer in particular, and they're really quite shocking. In Scotland in April, our cancer referrals from general practice, so patients presenting with symptoms that could suggest cancer and that needed further investigation, the referrals went down by 72% that month. And we know that this data is from England, but we know that in England, usually in April, we would see around 30,000 diagnoses of cancer. And the data is still to come in, but it doesn't look like we're going to hit 5,000 in England this April. So there is going to be a delay in diagnosis of cancer, and that will affect outcomes in a proportion of those cases. And it will lead to a huge surge at some point when people do start to consult again. It will lead to a bigger pressure on the system at every level. So we need to address it to reduce mortality. We need to address it to reduce the health problems that people will develop without early treatment. And we need to address it so that the system again can cope with all of this, so that we can spread out the demands on the system. There are also not just the new diagnoses that are presenting, but patients who have diabetes or high blood pressure, who normally would be attending the practice for routine checkup blood tests, or to see our nurses or GPs for just ongoing assessment to ensure that their conditions are well managed. This has all been cancelled. So that will inevitably have a big effect going forward. We're also worried about immunizations as well, parents being too afraid to bring their children for vaccinations. And we know that already the UK is no longer a measles-free country, and so this is a huge risk. If there's a cohort of children that aren't vaccinated against measles, which we think is more contagious than coronavirus, the potential for devastating outbreaks in the future is huge and very frightening. So this is something that really we need to switch our focus to avoid a really big problem later on in the NHS. So yeah, very, very significant issue.
Thank you, Louisa. It's really sobering and frightening, and just sort of underlines that this virus is affecting every part of our lives in ways that are really devastating. I'm going to move to read now and to education, because it's also affecting, of course, well, millions of school children who've moved online, and at the same time, the virus is affecting different communities disproportionately. And you were talking about sort of equity in education. How is this, when we're moving all these the learning online, are there ways in which equity is the inequities are being worsened, but are there also perhaps ways in which things are maybe being evened out in ways that surprise you?
Yeah, no, I think that's so that's the huge question now, and as we engage with families across the board, and hopefully, Philip, we kind of answer your question as well here. But as we engage with people across the board, we want to center family experiences and student experiences. My group works with a student organization that comes out of our project called Students and Educators for Equity, and we've been meeting weekly to talk through where are the spaces where we need support, where are the spaces where inequities are still thriving and hurting families and students. And largely what we've seen is based on where we see disproportionality impacting communities in our neighborhoods. So I'm in Crown Heights, Brooklyn, which is epicenter for some of the highest numbers of disproportionate impact on families of color getting COVID. So, and those same schools that I work with and train, those families have students at home that are really struggling to have access to online technology, struggling to have access to a space. For folks that have been to New York City, our apartments aren't large. So finding a quiet place to just to read, just to be on a Zoom call for 20 minutes is something that we're still not having across the board. We have 1.1 million students here, and we already know that there's tens of thousands that still don't have a connection that's reliable to a computer. So it's really important for us to think about schooling as an ecosystem framework to recognize that it's not these isolated pieces and products that we're able to give folks. And it's also not under equality. So equality is we give everybody the same thing. What that leads is a continuance and a maintenance of a structure that's not equal. So we need to reframe and think about equity as in communities that are already marginalized. How do we further support them? How do we make sure that laptop gets to that house? How do we make sure that teacher is able to spend a little more time supporting that student, knowing that there's 3 brothers and sisters at home? How do we support those pieces? So a lot of our work and training, we look at levels of vulnerability. So we look at vulnerability based on risk factors in comparison to protective factors. And we know contextually that folks with privilege, white middle-class people in New York City and upper-class families have so many protective factors already that COVID, well, it has hit everybody across the board, right? When you have protective factors in place to get services, to have a ventilator, to have somebody to help care for you, those levels of protection trickle down to what the supportive environment in schooling looks like. So there's a lot of questions that are arising now. Are you able to show a couple of those slides that I have, Maria? And no worries if you can't, but so the numbers here, which I'm sure you all have seen a lot of in terms of New York City and the disproportionate impact in New York City based on neighborhood and who's really getting that support and who's passing away from COVID virus, speak to that larger system that trickles down, right? The next slide, if you could show that, is really a representation of what we're seeing from families. So one of our leaders here in Brooklyn, he says, who are you saying needs improvement at this time? The parent, the student, we're already under stress. This was an add-on. This pandemic has shown the digital divide, the wealth divide, the difference between haves and have-nots in the city. And this grading policy and this negative language of needs improvement takes it to another level. So he's highlighting this idea that's the newest this week about how do we grade during remote learning. And there's a lot of generative dialogue, right? But the dialogue is often missing inequities that were already there. So, you know, Mayor Carranza, or the Chancellor and the Mayor have really tried to put together a plan that allows for students to come back and get support in the summer and the fall. But like our health experts on this panel have already kind of demonstrated, we don't know what the summer and the fall is going to look like. So how can we know and be confident that that support's going to happen for students that already were missing the interventions that they needed? So a lot of that is difficult to grapple with. I think when we think about, are there moments that the achievement gap can be assisted, we think about it as an opportunity gap and who has access to these opportunities. And where my center is really pulling moments of hope it comes from the idea of how do we reimagine these systems? How do we reimagine grading that looks at projects and looks at participation and looks at relationships? How do we reimagine what a classroom space can look like that's built on community? So a lot of my research and my background is in restorative practice. So restorative practice is a thought process and a way of being where we really focus on how we engage with those around us, how we build relationships, and how we really grow. What we're seeing in access to educational opportunities and outcomes is a deficiency in relationship building. So when we're trying to pull some data and what we currently have in this past month, Brooklyn and a lot of districts in New York City are pulling participation numbers. Classrooms and school spaces that are getting lower participation numbers are seemingly the same classrooms that had lower attendance numbers that are connected to what kind of community and what kind of relationships are built in those schools to begin with. We have folks that are getting every student in that Zoom session, even if they have to make all these extra, build the protective factors, as I highlighted before. So they're seeing the participation, but that's based on some more embedded thinking and way of being. And so we put out a remote learning guidance out of the NYU Metro Center about what do we need to really focus on. And the baseline for that is reimagining how we build relationships virtually and in physical space. We also are really pushing this idea of what does it mean to re-engage. And when we do come back in physical space, how can we utilize this as a moment to really think deeply and not fall back into systems that continually disproportionately impact families of color, low-income families, and families that are in the same communities that are most impacted by COVID right now. So we keep pushing these ideas, we keep supporting. Meanwhile, a lot of my day-to-day is spent training, looking at anti-racist methodology and what does it look like to really interrogate your own privilege, bias, and power, and how that can then impact restorative practices and building community at schools. We have transitioned from those physical trainings, that consulting, to doing virtual Zoom sessions, and we see that this is allowing for a lot of teachers to reimagine what it can look like when they go back. One teacher said yesterday that she's really worried because the students that we're already not being connected with are even less of a connection point. So really holding that as sacred and thinking about what can we do with systems and beliefs and policies to really interrogate that and to move forward in a positive way.
Thank you so much, Reed. I wanted to ask a quick follow-up from one of the Fulbrighters in the audience, Philip Palios, talking about teaching assistants who've been put on furlough, and is there any creative role for them in this present crisis?
I mean, I think that's another systemic issue that we're noticing. There's huge budget cuts, so people are getting put on furlough, and that's impacting what's happening with educational outcomes. So there haven't been, people are imagining what can happen with those structures, but right now it's a space of being cut. Along with those imperative roles like TAs, we're getting student organization funding cut. So summer programming where students get paid to work, that's one of the first things on the chopping block. So that's where I think the rubber hits the road, where we're giving that space of this is important and what we're deciding goes. But that's a huge tension point. So there aren't really answers there yet. But I think the push is to really think about how can we reimagine essential workers as well, because my TA my first year in the classroom was definitely a better teacher than I was. So how can we do that work and support each other?
I think you make a really good point about, sort of reimagining the world, because it is, it's been dealt such a blow that there are those opportunities to do that. And obviously that's something also that you're thinking about, Stephanie, and there are a cluster of questions here for you about cities, but with the sort of the caveat about all of us now so used to social distancing, that we're sort of nervous about getting together with other people. So Roger Gorgeous is asking, what is your vision of how cities will look if we need to maintain social distancing for an extended time? And Philip Palios is also making the point that, he's been working remotely since March, and the post-COVID-19 city is going to be very different than the pre-COVID-19 city, and will they have lower populations? And I would just add to that the sort of the fear factor, unfortunately, that's crept in to people being very nervous about being around other people. How does that affect your thinking?
That's a very complex, I have to say. I think that post-carbon cities will have much smaller than what we have today. Probably no bigger, a big agglomeration would probably be 500,000. So I think that as far as people working remotely or finding other ways to participate, that will have to happen, because the carbon intensity of big cities is just unsustainable with renewable sources of energy. You blanket your whole country with windmills and solar panels, in which case you can't grow food. So there are some really serious system energetics there around renewables. I also think it's important, and one of the questions I had from my co-panelists is actually many of the Asian very dense cities seem to have been able to flatten the curve. And in fact, the numbers of people infected have gone down tremendously. So I'm not entirely convinced that there's a relationship between how we've been interpreting social distancing and the transmission of the disease. I think that in Asia, you don't tend to touch, you don't tend to get very close to people, except say on the subway or something. But it's not the cultural norms are not about a lot of touching. And it may be that our cultural norms will evolve in that direction. It doesn't mean that you're 6 feet apart from everybody all the time. And I also think that this is an episode. This virus is an episode. It's not a permanent virus, probably, and that we will gradually no longer need to be quite so socially distanced. So I think it's all in the nuance and in accustoming yourself to, say, wearing a mask. There are changes that will occur, but it doesn't undermine entirely how we interact at all. And in fact, there are very dense cities where COVID virus has been managed. So we need to observe what's happened elsewhere and learn from how people there have been able to address the problem.
Would either Louisa or Laiba care to comment on the question of the different cases of different cities with and how they've coped with the virus?
I think that's really interesting, and it's very hard to say at the moment because we were dealing with such different places and different cultures and different population densities. I think it'll be fascinating to look back on. The other comment that I'd like to make is I'm not sure that this will be the worst pandemic that we see in our lifetimes. And so I think that with everything that we're doing, we need to be planning for when this happens again. And so I think we do need to think of how social distancing might be maintained in the future, because I think this will happen again.
Yes, thank you. Thank you, Louisa. Although it's not something one likes to be reminded of, but I think that's probably that is the warning that one is getting. And that's why vaccines for these viruses are so critical. And the question for Louisa and Laiba is from Charmian Norman Taylor is, how can we ensure that any vaccine for COVID will be distributed equally? Pharmaceutical companies aren't interested in developing drugs for use with acute respiratory infections such as COVID-19, as there's not enough return on their investment. Their investment is in drugs for chronic diseases such as AIDS and hepatitis B. So what will happen to all the research that, for example, Oxford is currently undertaking? Laiba, would you like to go for that?
Yeah. I think because vaccines are seen as really one of the few real routes out of this coronavirus crisis, there's a lot of fear already increasing, and this even creating and testing, mass producing a vaccine is an epic challenge. So the political and ethical decisions around its distribution are just another layer to add on to that. And I know, there's questions being asked constantly about when will the eventual vaccine be shared? Who decides that? Will supplies go to the highest bidder? Are the rich nations buying up these vaccines already? There's so many questions, and honestly, there is no answer to these questions. I mean, like looking at the experts in the industry, they're saying it could take a year or longer to even get a vaccine out. And with this 12-month queue in the line, there is no process established for like policing the impact of fair distribution, and because of this, a vaccine queue is kind of bound to happen. But in terms of providing a little bit of hope, I know recently there was a virtual event that was co-hosted by the World Health Organization and the President of France and the European Commission, where they all pledged to work towards like equitable global access that was based on level, like the partnership, and agreeing to come together for creating a strong unified voice to build on past experience, and to be accountable to the world. So although there's no system in place, I guess we'll learn as we go to kind of make sure that some level of fairness and equity is out there when a vaccine does arrive.
So Laiba, this is another question for you, and this is also a potentially positive outcome from Sophia Wicks asking you if you think that COVID-19 will result in a change to how we frame clinical trials in the future. So for example, analyzing drugs simultaneously as they come out and producing concurrent research projects and cyclical trials and so on. Yeah,
the landscape of clinical trials is evolving so much because of scientific breakthroughs and as technical innovations emerge, and the ongoing advancements in the cloud technology and combined with video conferencing and wearables, this opens up an unprecedented opportunity for pharma and healthcare to really bring about this evolution of clinical trial management. And I think from recruitment to submission, hybrid and virtual clinical trials and digital healthcare will likely become this new normal post COVID-19. And there's so many benefits to virtual trials, both in the short term and in shaping the industry in the future, because as you can see, virtual visits and remote patient monitoring in place of on-site visits gives trial participants a choice, as well as this added peace of mind that they won't be exposed to an unnecessary risks. And the virtual visits also allow sponsors to reach this larger population of participants, which really improves subject recruitment, engagement, and not to mention retention. And that's just one side of it. You could also look at analytics, where insights collected through these digital health technologies really enable continuous real-time data collection. So ultimately, I think this virtual connectivity and monitoring and management can really reduce the time commitment, effort, and burden on investigators and CRCs and participants. So really see that as a positive thing.
Thank you, Laiba. This is a question now for Stephanie, going really global. Within the opportunity from Rene Ormond, asking, within the opportunity that COVID-19 has presented to decarbonize cities globally, how can we begin to build equity between the developing world and the developed world?
Oh, if somebody had that answer, they would be really insightful. I think that the structural conditions that have led to inequality are extraordinarily complex, and that it would be foolish to think that this one event will trigger a global reordering of how things, of inequality. So I can't answer that question very well. I think it depends a lot on how the developed countries, the rich countries, are able to reassess their development pathways, on are we continue to accept the dictatable front, or are willing to say we cannot have global pharma deciding our health futures for us, and we need to invest in much more publicly funded medical trials, and also developing new medicines. That would in itself be a revolutionary approach, so that profit is not what motivates the pharmaceutical solutions. So the question is really very multi-layered and involves lots and lots of different parts of the system having to change dramatically. And I don't think that the virus, the way it's been handled today, where even in the United States, states are competing against one another for materials, for health, for safety, makes any sense whatsoever. But it is an example of a prevailing worldview today, an ideology about competition, and that the winners, people who don't compete well, are losers. And so until we have a really deep reevaluation of even that premise, it's going to be very difficult. I'm sorry to be so pessimistic about it.
Well, that you've given us both signs for, grounds for optimism and grounds for pessimism. So I think that's an honest approach. And I am going to turn to Reed now. I think maybe we'll see, we have 7 minutes left, but Karen Renault is asking about parents monitoring what their children are doing online. So that when there's that extra layer of complication, right? So particularly if parents are doing their own job and monitoring multiple children. So children exploring online and experiencing harm, is this something that you are looking at as well when you look at the sort of impact of online learning?
Yeah, I mean, I can't speak directly to some of the tech concerns, but in terms of policy changes that have happened in New York City, they moved away from certain platforms and have leaned on other platforms because of incidents occurring where people are popping up in the chat rooms, etc. I think we're gathering a whole slew of best practices around how do we use the technology, how do we minimize that, right? So I think some of our educators are saying one of the best ways is to pre-record, add your questioning within that pre-recording, and then share that, and then students engage that way. So it limits the amount of what could happen in the World Wide Web, I think. It's hard, obviously, depending on age as well. We don't need 6-year-olds staring at the screen for 3 hours a day. So I think that's also one of the big struggle points. How do we allow for educators to engage while families have to work, but not engage too much where students are in front of screens too long? So yeah, the platforms are ever evolving. We've already seen changes in Zoom. We've already seen people kind of put in levels of protection to make sure that you're opting in, you're signing in, rather than a public platform. But it's a really hard question, and I think and I hope people are making some big pushes there in a positive ways. But I know there's been a lot of glitches just in getting people online in a way that's fluid and allows people to engage together without other tech issues.
Thank you. So this is definitely, the last question is quite a specific one for Stephanie from Jonathan Bolavong. And he's asking Stephanie about how you suggest cities navigate the trade-off between increasing recycling and reusing items and increased sanitation needs in times of a pandemic. And that this being particularly pertinent given how sanitation practices tend to be energy intensive or environmentally hazardous.
Oh, that's a really good question. I think the first step is to reduce the volumes of waste, for sure. And in a more in a future where people are more aware of resource constraints, because the constraints are here now, we will move to a system where we generate a lot less waste. So I was just thinking the other day about what it would take to get the supply chain of, say, beauty products to provide your beauty products so you can refill your bottles on a regular basis, that you're not throwing them in the trash. You know, and so on and so forth. This has been a long-standing discussion in urban settings, and because we have not addressed the manufacturing process and have relied on consumers to take the responsibility for recycling rather than the manufacturers to reduce the amount of materials that they use, we end up trying to figure out how to do the thing that's right. And that's a absolutely endless approach, because we'll never catch up. So I think that the problem for waste is a much more structural one, and we have to really figure out how to generate packaging that is much less that's much less packaging, and then we have to figure out how to simply reuse what exists. So for example, there was a huge effort some time ago, and I'll finish on this, around what they call the white objects, I think that's what they call. So call them. So refrigerators, for example, there's no reason you couldn't just replace the motor of your refrigerator whenever it breaks down, and not replace the whole refrigerator. There's no reason why people need to be buying fancier and fancier refrigerators and throwing the other ones out. Your computer is exactly the same thing. There's a whole set of gadgets and objects that, instead of throwing them away, you should be able to simply replace the components forever and lease them, not even own them. Why do I need to own a refrigerator anyway, if I can simply have an object that's a service item? So that, that begins to sketch out a different future where there's less burden on those who do the recycling, who do the trash collection, and on the consumer to assume the responsibility for managing these really difficult problems. Thank you.
Thank you, Stephanie. And thank you to Laiba and to Reed and to Louisa for your generosity and openness in discussing all these issues with us, and to everybody for their questions and for your engagement. And I'm sorry we didn't get to all of them, but we did get to the majority of them. I'm happy to say. I think that this has been a really fantastic showcase of just what the Fulbright community brings together in terms of expertise, plain talking, sort of initiative and problem solving, and doing so with compassion. So thank you again, and hope that we will meet again at one of these events. As I said, this is one of the this is our first in a series of virtual Fulbright events, and we'd be really grateful for your feedback on what you thought worked, what you thought we can do better, and also for your ideas for topics for future events. So look out for a very, very brief feedback form later today. So in bringing this to a close, I want to wish you, from everybody, all my colleagues at the Commission, who of course are also all working remotely, all our best to all of you, and to stay safe and stay well, and stay in touch. Thanks very much.